Welcome to today's edition of, I'm going to go through another tutorial. I'm your host, Jesse Sawyer, a nationally recognized inclusive fitness trainer, Silver Sneaker Flex instructor, and you can find out more about me and visit my website, www.jessesawyer.com. Now, today's tutorial is going to be for the trapezius, and no, I'm not talking about those gymnasts, I'm talking about the trapezius right here, especially for that older adult, that silver sneaker member that I typically run into, or that aging or a disabled population that I work with. Now, this can be utilized for an ambulatory population like myself as well. It's just a tutorial so that you kind of understand how that trap works, and then I'm going to give you a few different alternatives so that you can work those into your routine at a silver sneaker class, at a local YMCA, at your Planet Fitness, or just on your own throughout the entire day so that you strengthen that trap. Now, when you think of trap, you just think of one, correct? No, you actually have three trapezius. Yes, not the gymnast again, doing rings. You have three. You have your upper trap, you have your mid trap, and then you have your lower trap. Now let me explain what each of them does, and then let me show you three different moves so that you can attempt to engage them and then ultimately give you greater posture, bring back that head from jaunting forward, and help that thoracic kyphosis so that it doesn't roll forward and you look like that creepy old man or creepy old woman walking down the street. So the upper trap right here runs alongside that neck and on top of the shoulders. What that does is it lifts up the scapula. So a common trap exercise that you're going to see in any class or in any gymnasium or fitness center is just straight up and down. What that does again, it lifts the trap up and it helps hold the glenohumeral joint, this ball and socket joint, in place. That's the main goal of the trap. Now, that mid trap adducts. When I say adducts, it brings the shoulder blades together. That's the main process of the mid trap, is adducting those shoulder blades together, and it connects kind of to the rhomboids in the middle of the back or in the middle of the scapula. So if you do both of those exercises, that upper trap, right, kind of gets that glenohumeral joint in place, helps with the jaunting of the head forward, and then you go and get that mid trap retracting the shoulder blades, you can actually feel the chest and the diaphragm expand, and you can actually feel your shoulder blades, if you do it correctly, retract and pull your shoulders, the glenohumeral joint, into place. Again, helping with that rotator cuff discomfort. Now, that lower trap, it drops the scapula down. So it pulls the scapula down and in place and lowers it more into that spine. It's the harder of the traps to hit, and there's certain ways that you can do that in the seated position or in the standing position as an older adult, and I'm going to show you that as well as we do these three different exercises. So we're going to work on the traps. It's a tutorial: upper trap, mid trap, and lower trap. Lower trap definitely the harder one to hit in form wise, but I'm going to show you all three standing and in their seated position for that older adult, or that, executive that just needs a quick tutorial on how to do this. So your upper trap, pretty simple, right? Standing, toes over knees, knees over hips, hips over shoulders. Don't mind my Uggs. It's just a really comfy morning, so I figured I'd be comfy with you. Upper trap, side view, just looks like this. All you're doing is shrugging straight on up, and all that's doing is lifting up the scapula and placing the glenohumeral joint in place. You can do this in a neutral position, just like I have it. You can do it in pronated position, and you can do it in supinated position. Either grip is going to still do the exact same thing. So changing your grip and staying vertical, again, you're just lifting up the scapula and engaging the trap so that it sets the glenohumeral joint or your shoulder in place and helps with the jaunting of the head so that your head's not jaunting forward, because that's not what the trap's meant to do. Again, it's for the shoulder. So it's just straight on up. And you kind of just want to let your hands, sublux, or would I say your shoulders sublux, just dropping them to the side. I prefer the neutral position. Some individuals pursue the supinated position because they feel like they're driving their elbows back. But if you're in that supinated position and you're driving those elbows back, you're going to hit more of that mid trap. And that's what I'm going to show you right now and how to engage that mid trap. Because again, you're adducting the shoulder blades. You're pulling those shoulder blades together. You're retracting those shoulder blades. So the easiest way that I've learned to do this, especially if you just want to stand straight up vertically, is you want to have mobility of the shoulder, so you want to drive those shoulders back just a little bit. And because you take them back a little bit, those elbows naturally bend. And then you're going to lift up, right? So you're going to feel that upper trap engage, and then you're going to retract and squeeze your shoulder blades together, which gets the adduction of that mid trap. So you're getting upper trap and mid trap at the same time, standing nice and tall. Shoot those arms back about 2 to 3 inches, lift up, upper trap, and then retract those shoulder blades, and you're gonna hit that mid trap. So here we go. I'm gonna show you again from that standing position. You're just gonna float those arms back just a tad, lift up, and then retract. And you can see, if you watch me do this correctly, lift, retract. And you can actually really feel those shoulders, or the glenohumeral joint, really going into place, and it's really pulling you in a greater posture. So again, for posture deficits, for somebody that's really struggling with that, because you sit a lot, you got a tech neck, well, this is a great exercise for you to do because it is going to impact the upper trap and that mid trap. Now, how do you get that lower trap? Well, we did the upper, right? Pull those arms back a little bit, up, and then drive, retract mid. And now in order to get that lower part of that trap, you almost have to drive those arms down and in. Because the lower trap is pulling the scapula down and in. And if you know anything about the insertion point of your back muscles, they run down and in. That's the insertion point of your back muscles. So your scapula as well, because it's trying to push your chest out, give you greater posture, concave at that lower lumbar. The scapula, the lower part, has to run down and in for you to hit that lower trap. Really difficult to do. However, there's other exercises you can do besides a shrug to get that lower trap. So again, you're gonna just flow them back a little bit, lift up, hit that upper, squeeze that mid with the retraction, and then almost like you're pushing those arms down and in, and pushing that chest out or rolling that chest out, and you're gonna hit that lower part of the trap because the insertion point is running down and in. So let's run through them. I'm gonna do 8 just standing in this standing upright position with my hands in neutral position for that upper trap. And there's 1, 2, 3, 4, 5, and again, this exercise 6 just lifts up the scapula, 7 and 8, and helps place the glenohumeral joint in place. Now, for that mid trap, I'm going to show you that side view so that you can see I float my arms back a little bit. Naturally, the elbows bend. I lift up, and then I squeeze and retract my scapula. Rest down. Pull them back, up, squeeze, and down. Now my hands are staying back here in this position because I'm versed in doing this, so I already have them in that mobility position. Up, that's 3, 4, 5, 6, 7, and 8. And you don't need heavy weight. That's a misconception. You don't need heavy weight to engage because your goal is to get engagement of the upper and the mid trap. Now, for that lower trap, I'll show you again side view. We're just going to go straight on up, but I'm going to retract just a tad with those elbows or work on that mobility. Up, retract, and then I'm going to push down. Retract, push down. Now my hands are already in that mobility position, pulled back, because it's just natural for me, but if you need to pull them back about 2 to 3 inches, lift up, retract, and then drive down and in. There's 4, 5, 6, and again, my hands and my trap and my scapula, they're already in that retract type position. They're already going back in the postural plane. Now, if you want to do that in the seated position for that silver sneaker member, that aging adult, clearly you can do this in that seated position, nice and that is just lifting the scapula. That's your upper trap. If you want to try to get that mid trap, again, you float them back. You can probably see this from the chair a little better as I float, lift up, retract, drop down, pull them back, lift up, retract, drop down, pull back, lift up, retract, drop down. And now to try to get that lower part of the trap, you're working on that mobility, you're up, retract, and then I'm pushing back and down. So you can see the difference from that mid trap, right, where I pull back and squeeze, that's getting the mid, to where I'm trying to get the lower trap, retract into the mid, and now I'm going and getting that lower. So again, it kind of elevates me up a little higher, it fixes my posture, mid, and then get that lower, and you can see it really helps me stand a little taller. Now, one more way to do this is you can always hinge at the hips, which is my preference because it feels like I get a little better with engaging my scapula or getting that mid trap and that upper trap. So this would just be my upper, this would be my mid, and it automatically hits it because you're already in that bent position. So in order to pull the chest back and the shoulders back with this slight hinge, you automatically, as soon as you go into that mobility and pull those arms back and retract, you automatically hit that mid trap, and then again, you'd want to push down to hit that lower part of the trap. Hopefully this helps you for those instructors out there that are specifically targeting the older population, that aging population, that silver sneaker population, or if you're just trying to learn how to really engage. Remember, it's not about the volume, or I would say the amount of weight that you're trying to lift to engage that trap. It is about doing the form properly and hitting all 3 areas of that trap. And that, in fact, if you do that, will give you greater posture, help with pain management, and reduce that forward joining position, either it be in your shoulders where they're concaving, or if it's the diaphragm that's getting tighter and you're having difficulty with breathing, or if it's just migraines in general that you just want to have greater posture. So hopefully you enjoy this. Please subscribe, please like, please share, and keep coming back for more tutorials just like this. Peace, my friends.